I think the question was about do I believe that there'd be a selective data collection and dissemination, and I think so. I think that this is the whole issue has been managed, and I think, as I said earlier, I think that the whole crisis that was created by them, I think that what the Gordon Campbell Liberal government is doing at this time is, I think that they're going to modify their policy, their social policy on health care. And I think that they're going to modify it because of such overwhelming support for the public system. But this is just an exercise in testing the waters to see how far. And that once they modify to their new game plan, that they will selectively retrieve comments that will fit with this new reality that they are crafting. And my experience in the Burnaby conversation, I went into a conversation at the end, and it was about human resources. That's how they termed it, right? And like elsewhere, it's really hard to get people to commit to a certain, you can get any kind of feel for a young person going out there and working these days. Excuse me. And we were talking about how to maintain and keep and recruit people into healthcare, certainly the public sector. And so one of the things that I suggested, of course, was stop contracting out. And the facilitator would not write this on the board. I said, you forgot, it's not contracting out. 3 times, and each time I raised my voice slightly. There might have been a hearing problem. And finally, this person, I said, are you going to write that on the board, yes or no? And they wrote it on the board with great reluctance, because all I said was one of the solutions might be to stop contracting out, right? Make it a stable employment area. And so that speaks to what Bill was saying. And, the other thing that I spoke to somebody on coming out of the building that day was, it always feels good to be able to voice our opinions. It always feels good when we feel we're being listened to. Even if we're not, we went through an exercise where we all got to say what we thought in a very public forum, and we were told, at least, that we were being listened to. And because it was other citizens, I felt like the individuals were listening to me, but I was never certain that the government will.
Well, Sharon, I hope you're right. I hope they do listen, and I hope they are accountable.
Well.
One way to overcome this distrust, or skepticism, I should say, would anybody propose to the government that the final report and the policies that are drafted before they are put to the legislator, that actual citizens deliberate on what the outcomes are going to be, whether it be a referendum or whether it be more conversations?
Well, I think it's a good idea to bring it up in the legislature for the members, the MLAs, to discuss it. If the cost is not too high, a referendum also will not be a bad idea.
Well, I think the government's record has to be looked at here on enforcing the Canada Health Act, which they have not done. There's been a proliferation under a number of governments here of the private clinics, and the latest round was involving the urgency clinic, I think, on Granville Island, which is promoted by another private profiteer, shall we call them, who operates a clinic that apparently supplies services to the RCMP and the Workers' Compensation Board. I think the government has failed miserably in enforcing the Canada Health Act, and that includes the federal government. So we've got to hold both of them accountable for this in the future.
Okay, I think the government should, in reporting on the conversation on health, they should put out a draft, and it should be sent to everyone who participated so that people can look at it and say, yes, that reflects the conversation, or no, and that's not the government's prerogative to interpret what happened at these conversation sessions. So I would like to see a draft of their report.
If you can change your vote when you change your mind, that is what democracy is all about. Now polling.ca.
Perpetual democracy doesn't mean that you have to vote every day. It just means that you have the right and the ability to vote anytime you want. And that is what perpetual democracy is all about.
Nowpolling.ca and others ask questions about healthcare on their website. And I think these are also opportunities for people to participate and engage and to let people know. And certainly if that website receives a level of interest, if hundreds or indeed thousands of people respond to those questions, then that would have an impact on the public debate as well. And so opportunities like that provided by nowpolling.ca, not just during a conversation on healthcare, but 12 months of the year, are opportunities for people to participate as well. I encourage people to go to that website, nowpolling.ca. That's www.nowpolling.ca, and take a look at the questions and let their voice be heard there as well.
Do you see that that a key factor that is dependent on, say, this being a new relationship between government is what the end result is on the policies in relationship to health?
Absolutely. I think it's twofold. I think first, as we go through the process, it's important that people can observe that process taking place. So it's been very important to make sure that we post all the different pieces of input on the website, and that includes the transcripts from the regional forums, so that people are confident that the things they are providing to us aren't just being hidden somewhere and then we put out our own report based on what we think. So I think that's the first part. The second part is sticking to what we've committed to the public, which is having all the data, all the input reported out in the fall, and then moving from that to develop whatever recommendations we're going to be able to make. So it's going to be important to stick to those timelines for people, and I think it has been important up until now to make sure that people can see right through the process and into what's being provided to government.